Welcome back, Community Focus. Kenny Fogle here. Glad you could join us. We've got Mike McCants here now. Mike, you're with the Visiting Angels. And for somebody that's never doesn't know the first thing about Visiting Angels, tell us what that is, who you are, and a little bit about yourself.
Well, Visiting Angels is a nationwide corporation, and we do in-home care for seniors. We go into their home and help them with the activities of daily living. It was started in '91 around Philadelphia, I believe, or Baltimore, one of the two. Jeffrey Johnson was a social worker at a hospital, and he saw people being dismissed from the hospital with nobody to take care of them at home. So he started this, and then he picked up a partner, and now there's about 470 agencies in the United States. And each one's individually owned, so you buy it, and then they train you, and you open up your own office. And right now we have five in Kentucky.
Now, when you talk about Visiting Angels, I mean, when you send somebody into somebody's home, these are trained people. I mean, these are professionals that are, they're just not just babysitters.
Well, they're a little bit more than trained too, because we have a lot of CNAs come in and want jobs, and they're fresh out of a CNA class, and we say, no, until you have experience doing it, we're not going to give you a client. Get the experience, then come back to us, because it's not something that, you don't want to put someone in and they've never done that before. They've never worked in a nursing home or hospital. So we make them go out and get about 6 months of experience before we'll take
Now,
them.
when they go out, I mean, is it physical therapy? Is it blood pressure checks? What are they doing when they go to somebody's home?
We are non-medical, so blood pressure checks we're not supposed to do. We don't, any vital signs, because if someone would take a blood pressure and write it down and somebody reacted to that, it's kind of like a diagnosis, and we're not qualified for that. But with physical therapy, we've had people with knee replacements, and we'll go in and take care of them, and then we'll help them with their physical therapy exercises after we've been trained by the PT person that comes in. So we can do things like that. A lot of it is bathing. We have errands, transportation. Our smallest client right now is 4 hours a week. We go in one day for 4 hours and basically help him, get his apartment cleaned up, clean up a little bit for him, fix him some meals. We do have 24/7, where we've actually in the home 24 hours a day, 7 days a week. So we have anything in between there is fine.
Okay, well, who qualifies to do this? I mean, is there a particular target audience that you're looking at when you're talking about seniors, or is it just anybody?
It's actually any disabled person over 18. And what happens is it ends up being seniors.
Yeah.
But we have taken care of younger people. If they're having trouble, we can go in and help them, but we can't do anybody under 18. So. But a lot of them, we get a lot of referrals from the hospital, people being dismissed from the hospital. We've had nursing homes call us and say, this person wants to go home, can you take care of them? And I'll go out and do an assessment, and I'll look around at the house and make sure it's safe, and kind of see, is this something we can actually do? I've had to turn people down because it was, I've got a feeding tube or something like that. Well, we don't do that.
Right, Doberman.
Yeah, we're Doberman.
Be careful with that one.
I haven't read into too many of those, but they're out there.
Well, and is there any cost to the people on this?
Yeah, there is. It's unfortunately it is a poor profit company. And sometimes it seems like nonprofit, but we try to keep the cost low, because there's nothing to help people pay for this. If they have long-term care insurance, a lot of the older seniors have purchased these 20 years ago, and those are real good policies.
They are.
The old ones are. The new ones not so much. There's other ways to pay for it. The VA, we have 10 veterans we're taking care of, and the VA will pay us to go in and do that, and there's no cost to the veterans if they meet certain criteria. There's other ways to finance it. You can even use your life insurance to finance it, but since it's non-medical, Medicaid or Medicare will not pay for it. And that's probably the biggest thing when people call and they think that, okay, well, I've got Medicaid and we can't do it.
Well, even there, a lot of times it's not just the patient that needs help, it's maybe the patient's family. I mean, they're looking for somebody to come in and I'm not saying they're desperate, but at the times they want somebody to come in that's professional, that knows how to take care of mom, dad, or somebody that they are not prepared to take care of or don't have time to take care of.
Yeah, and it's a lot of times they just need a break. And the VA has a good program going where if you get approved by them, they also throw in 30 respite days a year where you can go in, and that's time for the family just to get away. And it's, you only use 6 hours at a time, but for 30 days, that's several times a month you can get away. And a lot of times we go in even when the family's there because they, like you said, they just don't know how to take care of them.
Absolutely. Well, my dad, I mean, he passed away several years ago, but I know he looked forward to his person coming in. He complained because he complained about how much physical therapy he had to do, and he'd say, but he'd get upset if they were 5 minutes late because he was ready for them to be there.
Yeah. And usually there's some resistance as you go in, and usually I'm called by a son or a daughter, you know, to come take care of mom and dad. And then, you know, the first question we ask, have you discussed this with them and what do they feel about it? And a lot of times there's resistance. There's, you know, it's a stranger coming into your home, and which is going to make anybody uncomfortable.
Right.
And one thing we try to do is before we ever start a job, I'll go do an assessment. I'll pick out a caregiver that fits the family. Then I'll take the caregiver out and sit them down and say, okay, ask them anything you want. And so that way before the first day even starts, they know who's coming in, they know something about them. And if there's something about them they don't like, they can say, well, would you mind if I looked at someone else?
Yeah.
And that's not a problem. I tell all the caregivers that could happen and don't take it personally. You know, we've had one actually turned down in 4 years, and that's because we just think she's a little too young. So, okay, I'll get someone older up here.
Well, I know, like in my dad's case, the person become part of the family almost because they were there every week, and so it was a very good organization. So, if somebody needs to get in touch with you, how do they find you? I mean, how do they find Visiting Angels? And I know you cover not just Nelson County, but you cover a wide range of Central Kentucky.
Yes, we cover 6 counties. We cover Nelson, of course, and then we have Marion in Washington. We have Bullitt, and we're really expanding in Bullitt. Hardin County, we're expanding quite a bit into Hardin County. So anything surrounding Nelson, we can cover. And we try to hire girls that are, I say girls, I shouldn't say that. We try to hire caregivers that are close to the client, so they're not driving from Bardstown, you know, to E-Town. I mean, it happens occasionally, but we try to do it so that somebody's local there. It makes the client feel a little bit better too, that their caregiver's only 5 minutes away rather than 30 minutes away. So.
And how do they get a hold of you?
You can call our office at 502-348-0377, or you can go online. There's a corporate number you can call, which will refer to us. But if you go online to visitingangels.com, there's a questionnaire you can fill out, and it will, when you put your zip code in, it will come right to me, right to my computer, and we'll call and set up an assessment. So,
and I know I've gotten several seniors have told me over the years, I don't have a computer, but if you do or somebody does, visitingangels.com is I find the best way to get to anybody anymore because it's hard. I can't remember phone numbers, but your office is located in Bardstown, down right near. And they're right near the office down with the West Stephen Foster, I believe it is, isn't it?
Well, yeah, we're on West Stephen Foster in the Marketplace building.
Marketplace buildings, it's right on the corner there. So if somebody's looking for you, they can easily just drop in if they had to, if somebody's there, or give you a call or go to visitingangels.com. Right. Well, Mike, we do appreciate you being here and letting us know about this service because, again, we got so many services out there right now that you really don't even know about until you need them. And then when you need them, you start asking questions, and it's nice to know sometimes that somebody is there and willing to help and able to help. And if you need help, they're there. So Visiting Angels here in Bardstown, and again, serving 6 different counties in Central Kentucky. Mike, we appreciate you being here and letting us know all about this.
All right, we're glad to be here. Thank you.
All right, well, thank you. We'll be back in a few minutes on Community Focus. We'll be right back.